On behalf of GFMD, I'd like to introduce Rx Destroyer, a controlled substance wasting system for healthcare facilities. The two different methods recommended by the DEA for the destruction of controlled substances are incineration or chemical destruction. Rx Destroyer meets the DEA requirements and guidelines for chemical destruction and accepts all formats of drugs. These include pills, patches, tablets, liquids, and creams. The Rx Destroyer container comes completely self-contained and preloaded with a carbon-based liquid mixture. It's simple to use and requires no preparation. Simply open the cap on the Rx Destroyer container and begin adding those drugs that need to be properly wasted. For pills, tablets, or liquids, just add them directly into the container. Gloves are not necessarily required. When wasting drugs from syringes or vials, simply empty the drugs into the Rx Destroyer container and discard the syringe or vial in a Sharps container. Note that the Rx Destroyer container is not meant to accept anything other than the drugs themselves. In the case of wasting drugs that require careful handling, for example fentanyl patches, you'll want to follow appropriate safety guidelines, including wearing gloves. Fentanyl patches can be placed directly in the Rx Destroyer container, and in the case of their being folded at the time of removal from the patient, simply cut the patch to allow contact of activated carbon with the drug. Once the patch is in, simply close the cap, remove the container from the wall mount, and agitate gently. Please note that documenting the witness destruction of a controlled substance does not change when using Rx Destroyer. For example, if you are currently documenting this destruction in your Pyxis or Omnicell systems, this will continue as is. The Rx Destroyer is not a one-time use product. It can be used many times over many months, depending on the amount of controlled substance wasting you have in your facility. It is not necessary to agitate the container after each addition of drugs. Rather, 1 to 2 times per shift is enough to get the carbon interacting with drugs. It is up to each facility to determine this frequency. On the exterior side of the Pro Series container of Rx Destroyer, there is a visible fill line. As you use Rx Destroyer, check the fill line periodically, and when that fill line reaches approximately 2 inches from the top, it means that it's time for final disposition according to your facility's established waste guidelines. It is likely that your facility has placed instructional posters either on the wall by each wall mount or secured to the wall mount that will summarize the material contained in this video. This poster also typically indicates which department within your facility needs to be contacted to remove the filled Rx Destroyer container and replace it with a new Rx Destroyer container. The Rx Destroyer controlled substance wasting solution is a simple, easy-to-use product that will work very well in most every healthcare setting. GFMD has specialists across the U.S. to assist you with any additional needs that you may have. We want to thank you for choosing Rx Destroyer.